You're listening to the Inflamed and Exhausted Podcast, the show for women who are tired of being tired. I'm Lieah Torbert, CEO and co-founder of Wellness by Davlie, and I've been where you are, burned out, foggy, and wondering why my body couldn't just bounce back like it used to. On this podcast, we'll uncover the real reasons behind your fatigue, inflammation, and hormonal shifts, and I'll give you practical tools and guidance to support your body, restore your energy, and take back your health, one small step at a time. Let's get to it. Hello, everyone, and welcome to today's episode of Inflamed and Exhausted, where we're talking about all the reasons why, as women, when we get older, we start to feel tired and cranky, and our body feels like it's fighting us every day, and things that used to work don't work anymore, and we don't know why. So the whole point of this podcast is to bring on the experts and dive into some of the subjects so we can understand our bodies a little bit better and get healthier and just feel better every day. So today we have a very special guest. Dr. Maria is here. She is an integrative and lifestyle medicine practitioner in Texas, and she has founded a company called Salud Revisited. She's also the author of Healing the Wounds of Medicine, Stories and Journaling for Physicians. After seeking healing for complex developmental trauma, she realized many issues in medical training and career foster an environment that can naturally lead physicians to live in sympathetic response. And she wrote this book with the hopes of helping physicians to heal and discover tools to regain their passion for patient care. In her healing adventure, she has chosen to practice more holistically. She is a certified yoga instructor focused on trauma, resiliency, somatic, and embodiment, and a heart math provider. She believes every physician deserves to discover their journey in medicine and live free and healed. So, Dr. Maria, welcome to the show.
Thank you for having me. It is an honor, and I hope that we can have some fun conversation that is also educational and people can learn, because I know that there's a lot of things out there in social media and overall on the internet, but most of all that the listeners just feel supported and feel refreshed and know that there's hope.
That is absolutely amazing. And I've been so excited for this interview because we're going to be diving into one of my favorite subjects, talking about genomics. But before we get there, I would love it if you could just take a few minutes and tell the audience who you are, how you got here, and just how you ended up on this journey.
So, my name is Maria, Dr. Maria. As you all know, I'm originally from Puerto Rico, and I have been here in the Houston area for almost 3 years this Christmas. And how did I get here? So, growing up, I had conditions, medical conditions that a lot of people would think that are more of like older people or adults. I live with diabetes, asthma, as well as chronic back pain. And in my own health journey, a lot of the things that helped me manage my symptoms, regain my life, so that it was not only managing symptoms or putting like that band-aid, but really regaining life function. It was a lot of the complementary, what some people will call complementary or holistic type of healings. And after I went to medical school, and once I started in residency, I started to become frustrated with how we would just see patients back to back, back to back, back to back. And it's not the only seeing patients back to back, but it was quickly, it was fast. A lot of the times it was just to give them their medication refills, adjust medication doses, depending on their labs. And it was just more lab refill of medication. And I become very frustrated because I felt that I was really not helping people get healthy, which was my original goal when I started to go to medical school. So in that frustration, I seek additional training. So I'm trained in lifestyle medicine as well as integrative medicine, and I also do medical acupuncture. Yet, one of the other things that I did realize is that sometimes in the traditional healthcare system, where For multiple reasons. The expectation is that, yes, you will see a lot of patients, quick appointments to meet metrics. You really cannot practice that way. And don't get me wrong, it is good to, in a way, have metrics and make sure that blood pressures are controlled and A1C are controlled and all of that good stuff. So that's not necessarily bad. Yet I do find that you can miss tools that people can use. And not only that, I also find that sometimes part of the reason that people are not adherent to their treatment is because that physician patient relationship has been lost. And I think that restoring that is critical if we really want to help people get healthier.
I just love hearing that because I'm sure everyone listening to this has been in one of those little 15-minute doctor's visits and, felt like they needed more time and to feel a little bit more comfortable discussing what was going on in their lives and being able to ask questions instead of feeling rushed. I know there's been several with, primary care and specialists where I've just really felt like I haven't been heard. And the whole point of the appointment has just been, do I need more drugs or am I okay? Let's check the boxes. And so I love being able to connect with doctors like you who are really taking that extra step and focusing your practice on really trying to get to know your patients and healing the whole person instead of just hitting those metrics, like you said.
Yes, yes. Absolutely important to know the patient more than the numbers or the illness.
Yeah. So when you're working with a new patient, because you are in this different model, like what does something like that look like?
Yeah. So the best way that I can explain it is people will come to see me and they will have an extended visit. So my first appointment is about 90 minutes. In that first appointment, I do a pretty in-depth intake in terms of their history and, yes, what medications and allergies they might have. But I also ask about pillars of wellness. So, food, and not only what they're eating, but I also ask what is their relationship with food, because I think that that is super important. Movement, stress, sleep. I also screen for adverse childhood events. So I screen for trauma besides the typical depression and anxiety screening. I ask their lung exposure to either antibiotics, hormones, as well as do they have any fillings, metal fillings or ceramic fillings in their mouth. So a little bit of a different and more extensive intake. And I do all the things that your regular doctor does. I then ask you questions, review your history. I then do a full physical exam. And besides that, my patients also get the what is called the HERA diagnosis. So that comes from Japanese acupuncture. The best way that I can explain it to you is using points of the patient in the body, specifically in the area of the abdomen and torso, the majority of them, to then assess and diagnose what meridians have imbalance in the body. They get a 15-minute acupuncture session, which is short acupuncture session, but again, I'm only assessing the HERA. And a lot of the time, what I find is that either their labs or the symptoms go with the findings of the HERA diagnoses in terms of the meridian that it's not imbalanced. So they have a very comprehensive, like first evaluation. They have never had acupuncture, get introduced to it. Sometimes people are afraid that the needles are the needles that we use to draw blood. And they're not. They're very small and thin. And I think that even that experience, and I show them the needle before I start using it, can be very helpful. And then they get what is called a protocol or a plan where I combine so their history, their findings in their labs, their findings in the Japanese like para diagnosis, and those meridians, and I put that all together and I say, hey, this is what I think that we should do. I also try to discuss with my patient. So do we want to do plan A, plan B? Where do we want to start? And have that conversation so that the patient feels comfortable because it is their body, it is their health, and they can choose. They can choose this is what I want to move forward with versus not. And then, of course, I explain all of their labs to them as well.
That sounds absolutely amazing. And I've never had acupuncture before, so I love that part about showing the size of the needle. Because yeah, like, when I go to do blood work, I always have to look away, and it's pretty stressful, and I know a lot of people feel that way out there, so
You should come to see me.
I might. I'm on my own health journey, and I'm actually, like, redoing some of my blood work right now, so I'm waiting for all of it to come in to see if what I've been doing is actually working.
There you go. And then it's more than the blood work. Remember,
Yes.
the body speaks.
Yeah, this morning it was telling me that I really didn't wanna go to the gym, but I went anyway. So, one of the other things that we talked about, we had a pre-call for the podcast, was one of the other, services that you have in your practice that you offer around medical genomics. And this has been something that I have really been taking a look at over the last few months. I am an audiobook junkie, so whenever I see something, I add it to the list, and when the credits pop up or it goes on sale, I'll pick it up. And the things that I have been reading are just absolutely fascinating about what we can learn when we start looking at some of these things. And I'd really love to dive into some of that today. A lot of the people listening, they may be familiar with like DNA mapping and things like maybe with 23andMe, or if they've gone to a different provider to do something like that. But I was wondering if you could break down a little bit like what it is that you're looking for and how it's different from if they've done one of these genetic tests in the past.
Yes. So, and one thing that I want to put out there, so it's not genetic testing. It's genomic, which is specifically looking at SNPs. And the best way that I can, and I think that this is the best way, it might not be the best way that I can describe what a SNP is. Let's just say that you have a plate of sandwich. Each sandwich is a gene, yet, and they're all made of like the cheese with a cold cut. So the snakes would be in that plate. Maybe there is one of the sandwiches that instead of having turkey has ham, and instead of having provolone has American cheese, right? So if these differences within that gene, within that sandwich, that some of us can have and some of us do not have, and that it also will depend in terms of did you get it in mom's gene and did you get it in dad's gene and both genes versus not. And a lot of these can influence your risk of developing illnesses. It can also influence how you're going to respond to certain medications like anesthesia or ACE inhibitors, right? Are you prone to angioedema? And should we not give you an ACE inhibitor? It can also help us determine people that perhaps have not developed celiac disease, but that they are at risk of developing celiac disease, and therefore doing a diet that is very low on gluten or even eliminating gluten at all if they have other, again, they don't have celiac, but they have inflammation in their body. So it can give us a lot of information, depending again on what test we order and what panel, and whether that is prevention, trying to understand how to treat you better in terms of medication, diet, lifestyle. It can also be used for mental health conditions, specifically anxiety, depression, ADHD, targeting medication, but also We can look at micronutrients like B vitamins, D vitamins, and we can understand that. I have seen this where people are like, well, I'm taking this vitamin, and well, the issue is not in that your body doesn't absorb the, well, let me put it this way. The issue is not that I need to give you more doses of vitamin D. The problem is the receptor. So then we have to treat you from like another point. So it can be very powerful, I feel, when we have patients that perhaps they're not getting better with the usual treatment, their usual medication. They have a lot of symptoms, a lot of things going on, but maybe their labs are normal. And this has been going on for a lot of time. So it really helps look, yes, genetically, but we're not testing genes. What we're testing is SNPs, which it's part of what is in your gene. But, I'm not testing, for example, if you're positive to the BRCA gene, right? So that's a gene. What I'm testing is for the SNPs or components that might be part of that BRCA gene, but that it's not the gene by itself. So hopefully I explain that in terms that anybody can understand it.
Yeah, I think that breaks it down pretty well. I mean, it's a huge topic to try to break down in just a few minutes, but I think it really highlights like the specificity of things that we can really start looking at. Especially, you mentioned if your labs are normal, right? Like I've experienced this where I go to the doctor, they run all my labs. They tell me metabolically I'm fine. My hormones are great. Everything's where it's supposed to be. And then I'm like, well, why do I feel like crap?
Mhm.
Why am I not sleeping well? Why do I wake up and I feel exhausted? What are all these other things that are going on? And so I think a lot of women are experiencing that frustration where they go to the doctor and the doctor doesn't really have anything for them. We're like, well, your labs are normal. You don't need a thyroid hormone or any of these other things, just eat better and move more, right?
Yeah, yeah. Which I'm not going to say that necessarily that it's not important. We all should be doing that. Yet, in spite of those things, there can be other things going on, or we can be definitely experiencing that, right? And I think that also it gives people an understanding. I At least for maybe 3 of my patients that I have done this testing on, it also gives them this understanding of almost to say, like, your body is different. And you might think that people know this because on the outside, we all look different. Yet, for some people to understand, look, at this very genetic level, microscopic chiquitito, your body is different and your body needs this. And whether that be nutrient wise, whether that be sunlight exposure because you are more predisposed to having seasonal affective disorder or like the blues, whatever it is, I think that for some people it's also very powerful because it's almost like it gives them the sense of like, oh, I am different. And the reason that I say this is because there is a lot going out there where there's like the very generic, everybody has to do this, and if you're not doing these things, if you're not eating this much of protein, lifting this much weight, walking this much, you have to like you have to hit all the check marks. And then, you have to use the same supplement that your friend is using, and you have to be taking everything has to be the same. And then they're like, well, I'm doing it and it's working for them. Why is it not working for me? So a lot of the times also for them understanding that their body is different provide relief, but also compassion. They start to develop self-compassion, which I think that is so important. Maybe I didn't heal them. Maybe they're still having the issues that they're having, but they have developed self-compassion, which it's a great tool to have.
I mean, mindset change is huge whenever you're trying to work on your health. And I have to remind myself of that a lot. And like, I've studied nutrition and fitness and all the different things that I can do to try to help get better after my bout with COVID and dealing with long COVID. And like, that's how I got my story started, like going down that rabbit hole. And then, like you said, like you read all these books, you study all these things, and then it's like, okay, you start making the lists and you got everything and you're just overwhelmed. Like,
Mhm,
even if you're
mhm.
doing, like, 50% of the things that you thought you needed to do, it's like understanding that that is a huge shift in your behavior and how you're feeling, and it's hard for us to measure that sometimes.
Yes. Oh, yeah. Absolutely. Absolutely. So I think that it can be a tool used in many ways. And I definitely believe that and then that the other thing is it won't change, right? So these are not testing or labs that we need to repeat every 3 months or every 6 months. And it's your information forever. And on top of that is really focused on health. And it will specifically the type of test that I do, it also lets me know for this specific type of SNP, these are the treatments that have the most evidence. So that a lot of the times also what happens is that we have to try treatments. Like again, people are different. We do not know how they're going to respond, how their body's going to respond. But with this, we can also cut some of that guessing time and try to focus and be more precise.
Yeah, no, I think that's great. And talking about like body changes and stuff with hormone fluctuations, and as we're heading into perimenopause and then menopause, and then all the fun that happens after that as our bodies are continually trying to adjust. It's like what worked for us at 35, it's not going to work for us at 50.
Yeah.
Biologically, we're different.
Yes, yes. And definitely, again, there's things that can be done to mitigate some of those effects as we are getting older and our body is changing and our biology is changing. And then I also think that going back to the compassion is understanding that it's not that there's something wrong with you that we need to fix, is that in a way our bodies have changed, our biology has changed. And I think that also our lifestyles need to change with it. And as you said, it is what work at year 35 is not going to necessarily work at 45. I definitely I have experienced that. And not only when I say lifestyle, a lot of people think of the eating and the exercise. But one of the things that my body just really doesn't want it. I just don't want to live in the rush. I'm like, I'm not. I just there's no reason to be in this like going. And it's not that I'm tired. I have realized that it's almost like I get like this bad adrenaline rush that my body just doesn't want it anymore. Yeah.
Yeah. No, I can definitely identify with that. I've made lots of changes in my life over the last few years from leaving corporate and starting my own company and all of that. Like, the pace of my life is different. And when I think about what it would be like to go back to that environment, like I feel that anxiety in my chest tightening. Like, no, I don't want to do that because I can't imagine living that way anymore.
Yeah.
Yeah.
Absolutely.
I work with a lot of women business owners, and we're type A, we're adrenaline junkies, we're perfectionists, overachievers, 150%. We have so many different things on our plate. And I think it's hard for us sometimes to realize that we're kind of doing it to ourselves a little bit. We
Yeah.
set ourselves up because we have so many things we want to accomplish and we all want it right now because why not? And then realizing, okay, if we change our pace, we slow it down a little bit, all of these deadlines we've artificially set in our own mind. And no one's going to be hurt if it's not done by Monday. A couple weeks from now is okay in a lot of cases. And really just trying to figure out what that cadence is so that mentally and physically, like, we can take care of ourselves and be able to actually support our families and our businesses and our employees and all those things that we're trying to do.
Yeah. And I think that it's not only the biology that changes, we change as person, right? the events that you have lived through from your mid-20s to your mid-30s start to change you. Start your values change, perhaps what your priorities are change, right? So as humans, it's not only that the biology evolves, you evolve as a person, right? You gain more knowledge. And maybe after you gain that knowledge, you realize, like, oh, something as simple as something to say, right? You all of a sudden. So, one of the things that I learned recently is that there's a specific types of vaginal lubricants that are actually toxic for like our good vaginal flora and for women. So what happens, right? You get older and we're like, well, use KY jelly for like a lubricant. Anyway, so I learned something new. So now my practice changes, right? And it's not that I was a bad doctor. I just learned something new. So I think that what I'm trying to say is like the evolution of who I am as a person happens not only biologically, but also happens in the mind and the emotions and the spirit of who I am and embracing change. I think it's wonderful.
Yeah, no, I agree. And from a lifestyle perspective, like when I'm talking to people, it's like, and I find myself using the wrong words talking to myself too. Like, I have to go to the gym today, or I have to do this, or I have to do that. And really like trying to change how I'm wording it because going to the gym is going to help my stamina. It's going to help my hormone health. It's going to help my muscle production and my bone
Mhm.
strength. It's gonna keep me healthy. Like my mom has a lot of health issues and she's had 2 hip replacements and I've seen how hard she's struggled because of the things that she's gone through in her life. And it's I don't want to live that life. And so like going to the gym, like it's something that I want to do. It's also something I feel like I need to do, but
Yeah.
it's going to help me achieve all of those other things that I want in my life.
Mhm. Mhm. And sometimes we just do not know what that is, or sometimes that changes as we just evolve.
Yeah. I mean, 5 years ago, I didn't even know that's what exercise did. 5 years ago, I just thought exercise might help me be a little less fat. So, it's like as we learn the how we're looking at things changes for sure. So I think like we've covered a ton of things like stress, lifestyle changes, all of those things. I don't know if this really applies from like looking at just the little pieces that you're looking at, but I have seen some comments out there in the forums and in the different Facebook groups and stuff where people basically are like abdicating responsibility and just kind of giving up on their health because they found out something about their genetics that they feel like they just can't overcome.
Mm, mm. Yeah, so I think that that's a very interesting point because what what we have, at least genomic wise and nutrigenomic wise, and one of the reasons that we do this testing is because we do know that there's intervention. So, and I think that it will depend on like what. So one, there's a lot of testing that people are getting and ordering on their own. Not only tests that are in the genetic realm, but I have patients or prospective patients that already have like their gut microbiome testing or this testing done, and they have decided which company to use, which test to use, and then they're like, and what do I do with the results now? And I'm like, well,
Right.
that's why you need a doctor. The first thing that you should do is just discuss that with the doctor. And at least a responsible physician, like we know that the test that we're going to do is because we're looking for things that we can do intervention in. So even if you tell me, well, I found out that I am positive for BRCA1 and BRCA2 genes, yes, in a way, there is treatment for that, where it's not necessarily that we're going to give you a pill or a supplement so that you don't develop cancer. The treatment is a little bit more aggressive, right? Where some women have to undergo surgery and then have parts of their body surgically removed to prevent developing breast cancer and ovarian cancer because of their family history and their genetic testing. So I think that those people that, for whatever reason, have come to that conclusion, what I would invite them is to one, know, okay, who ordered this test? Why was it ordered? What's going on? And then to have a truthful conversation with your physician, especially if it's physician order it, to see even if it's slowing the progression, right? So even in the genetic testing that I do, that we do testing specifically for risk of dementia, there are things that we can do to even slow the progression. So I think that my invitation would be, so if you have come to that conclusion for whatever reason, if you feel it is safe to have this conversation, go back to your physician and let's have kind of like heart-to-heart conversation of like, hey, I'm concerned that this is like a death sentence, and therefore I'm just going to viva la vida loca, like Hugh Martin said. Do you think that that's what I should do? And just enjoy life, because after all, we are going to die. Yeah, you're going to die at any moment, right? Anything can happen. But I think that there is hope. And if you have lost hope, then it is important that you find somebody that can give you and be the hope for you until you regain your hope.
Yeah, thank you. That's so powerful. Anybody, whether it's from their genetic testing or they've been diagnosed with something, having hope is so important.
Mm. Yes.
Yeah.
Yes.
Oh, thinking about my mom there for a minute, it's getting me kind of emotional with all the things going on with her.
Yeah.
Yeah. So I guess my final question for you is for the ladies out there. We've spent a lot of time talking about genomics, but there's the entire practice and all the things that you do. Like if someone is listening right now and they're just tired of being tired and they're tired of their labs looking like everything is fine and they don't feel like they're really ready quite yet to take to go do the testing or things like that. Like what are some things that they can do today that that they don't necessarily need a medical intervention for, but that can just improve their quality of life while they're working through who they want to work with and what path they want to go?
So, that it's not necessarily having like medical intervention. Then, in a way, and that they can start doing today, in a way, this goes back to lifestyle, but I'm not talking about diet and exercise. I think I would suggest developing a rhythm of introspection, calm, slow introspection. And this might not heal what's going on in your body, but it's going to start to bring clarity in a couple of areas. So one, sometimes when I start to work with patients, the only thing that they can tell me is that they have headaches, right? But if I ask them to characterize the headache, like what part of their body, is it associated with any foods? Is it associated with any smells, right? Like all of these other pieces of the puzzle that it is so important, they can't. And I think that it happens for multiple reasons. One, in the Western culture, we just live in our head, and whatever happens down here, we just do not know what's happening down here. We're not connected to our bodies. And it too, I think that again, the pace of life does not even allow us for the slowing down, connecting with our bodies and what's going on with our body, not only physically, but also emotionally and spiritually, right? As a person. So developing introspection, whether that is that you develop the habit of journaling, a rhythm where you journal, whether it is in the morning, at nighttime, a rhythm of doing a meditative walk, and whether you do this at any time of the day, and you can do it without music. I like to do it with something that helps me calm down, regulate. So anything that can help you as a person become more attuned to you. And not only to what is happening, but also to the challenge, the obstacle. And is that obstacle a true obstacle? Is it that there's truly a fear? Where is that fear coming from? Is that fear, right? Is it that you are scared that you're going to go to the doctor and they're going to diagnose you with a terminal illness? Is it a fear of like, I'm not going to be heard? Is it the fear of I'm going to be told again that I'm crazy or that I'm gaslighted? So what is keeping you? I can definitely tell you that nowadays, what keeps people from not seeking care, the two biggest things that I see, yes, it's related to finances, even if they have health insurance, but then also the continual mentality of I can do it on my own and I can figure it out on my own because I can look it up on Google and I can just do what Google tells me to do. And then they're
And
doing
like the
yes. Yes. And then they're doing things that again might not necessarily be completely wrong, but not right for them. And they're doing it out of the context of not knowing already what is happening in their body. So I think that again, this introspection, attunement to who you are, what's happening inside of you, on the outside of you, and then also an introspection of where your values are and where do you want to go in life? Because the reality is that it doesn't matter, even if your goal is, I want to retire at 80 because I want to work until 80. Well, guess what? You still need your health. If your goal is that you want to retire at 50 and travel the world, you need your health. If your goal is you're going to retire at 60 and take care of the grandkids, you need your health.
Yeah, 100%. 100%. I talk to the business ladies all the time. It's like you can't give what you need to give to your business if you're not giving to yourself first.
Absolutely. We need to love our first and not from this egocentric perspective. But it is a principle. If you are not good, everything else that you do and everybody else that you interact with will not be in balance.
100%. So we are out of time for today. I know we could just keep talking forever about this stuff, but Dr. Maria, thank you for being on the show. For the people listening, Dr. Maria's contact information will be in the show notes, links to her website, so you can reach out directly to her, learn a little bit more about her practice and what she does. Maybe get started on your health journey, or at least take Dr. Maria's advice. Do that introspection, start listening to your body, start trying to map out what you're feeling and how things are going, so that when you do go talk to your doctor, even if it's not Dr. Maria, you have the information that you need to be able to talk to your doctor and get some things started. Thank you so much.
Thank you. Thank you for having me. It was a pleasure.
Thanks so much for joining me today on the Inflamed and Exhausted Podcast. If this episode helped you connect the dots or gave you a new perspective, I'd love it if you'd follow the show and leave a quick review. It helps more women find this message. Remember, healing isn't about being perfect. It's about staying curious, staying kind to yourself, and taking the next best step. I'll see you next time.